chemotherapy is a dangerous health hazard. You should not use chemotherapy if doctors and nurses need to use protective gear to handle it. In this video, you will discover different types of chemo on the market and their purposes. You will also discover the steps doctors and nurses must follow before they give chemo to patients. And you will also learn about the hypocrisy of doctors treating chemo as a health hazard but still giving it to patients. The main purpose of chemo is to stop cancer cells from growing and spreading to other parts of the body. Cancer patients usually take it with surgery, radiotherapy, or only chemo itself. There are dozens of different chemotherapy drugs on the market, so these drugs are often divided into groups based on how they work. Each group of drugs destroys cancer cells differently. One chemo drug is alkylating agents. This type of chemo is the oldest one. Alkylating agents damage the DNA of cancer cells to stop them from making any copies. It's often used to treat lymphoma, Hodgkin's disease, multiple myeloma, sarcoma, breast, lung, and ovarian cancers. Another group of chemo is antimetabolates. So antimetabolates are chemo drugs that interfere with the normal metabolism of cells. The goal is to make them stop growing. Doctors often use it to treat leukemia and cancer in the breast, ovaries, and intestines. The third group of chemo drugs is anthracycline. These drugs attack the enzymes inside cancer cells. Cancer uses certain enzymes to divide and grow, and these drugs stop that. Another group of chemo drugs is mitotic inhibitors. These drugs stop cancer cells from making more copies of themselves. They also prevent your body from making the proteins that cancer cells need to grow. Doctors might prescribe them for breast and lung cancers, or myeloma, leukemia, and lymphoma. Topoisomerase inhibitors are cancer drugs that attack enzymes that help cancer cells divide and grow. These drugs treat some types of leukemia and cancers of the lung, ovaries, and intestines, among other types. The toxic effects of chemo have been well known since their introduction in the 1940s. Whereas experts in the health industry have created recommended practices for handling chemotherapy. In 1990, the American Society of Health System Pharmacists defined a drug as hazardous based on specific criteria. And in 2004, NIOSH expanded this definition. Drugs with toxic properties could pose a hazard to health workers. The majority of hazardous drugs are cancer chemotherapy agents. These drugs are toxic to both cancer cells and healthy cells. This table lists the known and probable known human carcinogens among anti-cancer drugs. Chemo can also cause fertility problems. Health workers can be exposed to chemo drugs throughout the drug's life cycle. It can start from the manufacturers that transport and distribute the drug to hospitals, and also when the staff tries to dispose of the drug. So the first evidence of workers exposed to chemo resulted from a study in 1979. This study said that nurses who handled chemo drugs had higher mutagenic substances in their urine. Other studies show that exposure to chemotherapy led to hair loss, headaches, skin rashes, and allergic reactions in workers. One study showed a twofold increase of spontaneous abortions in nurses who handled chemo. There were two Danish studies that looked at workers exposed to chemo. One study showed an increased risk of leukemia among oncology nurses from 1943 to 1987. The other study by the same authors found an increased risk of leukemia in physicians employed for at least 6 months. Health workers can get exposed to chemo drugs through inhalation, the skin, or orally. When doctors receive chemo drugs, they need to check the package. Each employee must inspect the boxes. They need to wear gloves and must use specific precautions if a dangerous drug package is damaged. Therefore, every hospital must have spill kits readily available in the chemo storage area. And all personnel must know how to perform a spill cleanup. The storage area must have good ventilation, and there should be at least 12 air changes per hour to reduce the drug residue in the air. And the staff must clean the space where the chemo is at least every 30 days with a detergent. Eventually, healthcare facilities will experience a spill of some chemo drug. Chemotherapy drug spills are incredibly harmful to people. So there's no safe chemotherapy limit for drug exposure. If there is a spill, the staff need to use the spill kits. The kit contains 2 pairs of gloves, a gown, eye protection, a respirator, and shoe covers. Other equipments needed for the spill kits are spill towels, 2 chemo waste bags, a chemo spill sign, absorbent pads or spill solidifier, a scoop and a scraper, and a spill report form. So when one worker at the hospital discovers chemo spills, there are certain steps they need to follow. First, they need to alert the people in the area of the spill and put out a sign warning about it. Then this person needs to put on the first pair of gloves, then the gown, followed by the second pair of gloves. And then this person needs to tuck the gown sleeves between the first and second pair of gloves. The next step is to put on the protective eyeglasses, a respirator such as a mask, and shoe covers. When they have done that, they then use the absorbent pads or spill solidifier on the spilled drug. And if there's glass, this person needs to use the scoop or scraper to pick it up. And then you need to use the spill towels, detergent, and water to clean up the rest of the chemo drugs. And these things should then go to the same bag. After the cleanup, the worker needs to remove the outer pair of gloves, the respirator, safety glasses, shoe coverings, and the gown. All these things should go in the same waste bag. Then you should close the waste bag with the inner pair of gloves and put it inside the outer bag. And then you need to put the inner gloves inside the outer waste bag and close it. After everything is done, the worker needs to dispose of the waste bag properly. And then they need to leave the sign in place until environmental services clean the area later. What's interesting about chemo is that it's hazardous outside the body, but not inside it. How can we use this toxic drug inside the body when we need to use certain precautions outside it? Chemo reminds me of amalgam tooth fillings. Both are toxic outside the body, but not inside it. So there are many side effects of chemo drugs. Many of the side effects of cancer are actually caused by chemo. When people think of a cancer patient, they often get a picture of a person without hair. Hair loss is not caused by cancer, but chemo. Chris Walk, that created the blog Chris Bit Cancer, didn't do chemo and he didn't lose his hair. Chemotherapy is toxic whether you're already sick or healthy. In one case, UK doctors misdiagnosed the mom Sarah Boyle with triple-negative breast cancer in 2016. And it was only months later that they realized their mistake. But this mom of 2 did several rounds of chemo, had a mastectomy and breast implants. What's interesting about this case is that Sarah lost her hair and had the usual side effects of chemo, even if she was healthy. Chemo is only capable of killing cancer cells in the short term, but it also kills healthy cells and destroys the immune system. Minor bodily infections in the future can lead to organ failure, internal bleeding, and death, which would never cause these serious side effects. How can we give people chemo drugs when they are so toxic that a spill in a hospital is considered a major biohazard? No hospital staff can go near a spill unless they are fully protected. How can chemo be in the best interest of the patient? Chemo breaks the Hippocratic oath, first do not harm. More people die of chemo than of cancer itself. One Australian study found that of the people that survived from cancer, only 2.2% could attribute it to chemo. But still, doctors pressure cancer patients into taking chemo when it's a considerable risk. They are not told enough about the enormous risk they are taking by having it. there is also a strong bias in the scientific community to downplay chemo's side effects. There are only two major conclusions we can make about the use of chemo. First, chemo is in the economic interest of drug companies. They earn staggering amounts of money on chemo treatments. The costs of cancer care are enormous. In 2011, cancer patients in the US paid $5.6 billion out of pocket for cancer treatments, including surgery, radiation, and chemo. Cancer treatments also represent a significant part of the total US healthcare spending. Cancer-related healthcare is projected to grow to $246 billion by 2030. People with cancer and their families often have to pay these high costs. They can also get help from their employers and insurance companies. If you have a health insurance in the US, you can often expect to pay between 10 and 15% of chemo costs out of pocket. Taxpayer-funded public programs like Medicare and Medicaid can also chip in. So you might pay between $10,000 to $200,000 or more if you don't have a health insurance. Another conclusion we can make about chemo is that it's designed to harm people. So it's evident if you look at the history of chemo, its side effects, and its horrible results. Did you know that chemo started as a chemical weapon? Fritz Haber, a chemist, created mustard gas. The German army used it in World War I against the British and Canadian soldiers in Ypres, Belgium in 1917. Two scientists, Louis Goodman and Alfred Gilman at Yale University, looked into the medical records of soldiers affected by mustard gas, and they noticed a low number of immune cells in their blood. And then they got the idea to kill cancer cells. They used this treatment on a patient with the initials JD. He had throat cancer, and after the treatment he was able to swallow again. But sadly he died 6 months later. But still, this chemical treatment led to chemotherapy. The current medical industry that we have today is Rockefeller medicine. John D. Rockefeller was responsible for creating Western medicine. He was an oil billionaire that wanted to use his oil to create drugs that could treat the symptoms of diseases but not cure them. The Rockefeller family and other families, such as the Carnegies, used their money and influence to take over the medical industry by forcing medical schools to teach about allopathic medicine. The Rockefeller family is also the biggest funder of the eugenics movement. Eugenics is the belief that the world is overpopulated and needs to shrink. So what better way to cull the population than using a toxic medical weapon? By calling it medicine, you are able to kill people without any resistance. No studies show that chemo is safe. It's also a known fact that it causes more cancer. You can download our chemo questionnaire to know what questions to ask your oncologist before taking chemo. So you will be shocked by what your doctor will reveal to you. I will put a link to this guide underneath the video. If you like this video, press the like button and subscribe to our channel. You can also visit our homepage, cancerwisdom.net, to learn more about natural cancer remedies. We have courses and a free resource library where you can download ebooks about cancer. And we also have a podcast that you can listen to. Thanks for watching this video, and I'll see you soon.